Since 1991, the ACMS Physician of the Year Award has recognized local members who have exemplified the profession's highest ideals. This year, the ACMS Board has introduced multiple categories to better reflect the diversity of ways in which members contribute to our community's health. Here to introduce the recipient of the Exemplary Patient Care Award is 2024 Physician of the Year, Dr. John Wardell.
The Exemplary Patient Care Award recognizes an ACMS physician who demonstrates exceedingly strong patient care both in interactions and medical outcomes. The 2025 ACMS Physician of the Year honoree for this award is Dr. Jerry Perez, who is a gynecologic oncologist who works at the St. Louis Cancer Institute. I wanted to begin by sharing a number of comments written by physicians and staff. During his early years in practice as a solo gynecologic oncologist and continuing until this day, Dr. Perez has responded to literally any obstetric or gynecologic surgical emergency, whether or not he's on call, offered returning early or urgently from time off to care for patients in crisis, including multiple times when he made trips from Sun Valley while he was on vacation and returned to help. From a clinical perspective, he has an expansive knowledge base and is always up to date with recent literature. His traditional and robotic surgical skills are legendary and beyond impressive. For many years, he and his team, which now includes Dr. Cooper and Dr. Taylor, who are both here tonight, have been taking fourth-year acting interns from the Universities of Washington and Utah medical schools to help train the next generation of physicians. He's also worked tirelessly to expand St. Louis' research program to bring cutting-edge research protocols to our cancer patients. These patients have consistently shared their stories about the compassionate care that they received from Dr. Perez and his team despite the difficult and overwhelming nature of their cancer diagnosis. He's also extremely efficient with excellent outcomes and low complication rates. As one of the senior OBGYN physicians still working at St. Luke's, I've witnessed the entirety of Dr. Perez's career in Boise and have been fortunate to interact and operate with Dr. Perez on many occasions. I simply find it difficult to find the words that adequately describe the impact that he's had on patients across Idaho, the entire medical community, and our health system. So it's my great honor to introduce Dr. Jerry Perez.
Well, thanks everyone. That was incredibly humbling. The word efficiency seems to come up pretty often. So I was told I have 4 minutes, so really quickly. Set a timer for 4 minutes. Sir Isaac Newton came up with a quote, and I'm sure you've all heard it. If I can see further, it's because I stand on the shoulder of giants. I've been very blessed in my life, and when I look at my life and where I've come, I have to look at 3 aspects: the past, the present, and the future. In the past, there's no way I can ever diminish the input that my parents had. 2 Cuban immigrants who had a nice, normal, healthy life, and then one day my dad walks into the bank, gets pulled into the closet and says, "You're on the list to be arrested, and your assets have been frozen. Good luck." He moves to the United States with his wife and 2 young kids, barely speaking the language. A couple of years later, he loses his eyesight. He pivots, never complained, head down, always worked, got it done. Great inspiration. And the one thing he always said is, they can take everything away from you, but they can't take away your knowledge, and they can't take away your education. So thank you for making me a lifelong learner. And then there's all the other people: grammar school kids, high school teachers, college, med school, fellowship, who I don't think I ever thanked my teachers enough. And looking back at where I am now, thank you to all of you. So where are we now? Now we're at St. Luke's, and it's not me, it's a whole group. From the housekeepers, who spend 10 to 20 minutes a day quietly and respectfully going into patients' rooms and cleaning. And there was a nice study published from the Yale Business School where they asked quotes because they felt that this was the hardest job. And some of the quotes were, I know when I go into a patient's room and I clean, maybe I'm making the recovery a little bit better. And maybe their son or their daughter, because it's a nice, calm, clean environment, are willing to stay with that patient for another 10 to 15 minutes. And that, I think, makes a difference. But it goes all the way from them to the gardeners who are out there at 4 a.m. in the winter throwing the snow, all the way up to the CEOs and the directors of medicine who have to make the tough calls about who gets cut, where the money goes, and what programs get advanced. But really, the today is all of you. It's the physicians, it's infectious disease, it's nephrology, it's the OBs, it's the general surgeons, it's the interventional radiologists, it's the slim doctors. Oh my God, the slim doctors, I can't thank them enough. Totally undercredited. Because without them, none of this would be possible, and the patient care that we deliver would not be possible. On a little bit more of a home front, the president is also Martha Navarro. Martha's been with me for 30 years, came with me from California. I think 80% of the people in this room probably know Martha by name, even though they don't know who she is. She has a habit of, and a skill to make everyone comfortable. She shows every patient the deepest respect, regardless of their social status or how annoying they can be. And some of them can be annoying. And also, obviously, I couldn't do this without my wife, who I'm sure most of you know has been okay and goes with the flow when we have to turn the car around and come back as the hospital calls. Or she cooks a great dinner and I come home and it's under foil because, yet again, I'm late. So to my lovely wife, Anne. So moving quite along, I'm down to 3 minutes, 50 seconds. But anyway, I also need to thank my clinic nurses and especially the PAs, Misty, Christine, Casey's not here today for all they do. And then I have to talk about the future. And the future really belongs to my kids, Patrick, who is the most focused, energetic kid I've ever met, and my daughter, Marilyn, who has the world's highest emotional IQ, who have showed me that everyone is of value and that we can make the world a better place. They get me out of bed every morning. And then lastly, I'd like to thank my two partners, Dr. Cooper and Dr. Turner, who together will always keep the shenanigans going. I'm not there at that point where I'm willing to turn it over, but I know that it's coming, and when that day comes, I know I'm leaving it in good hands. In short, giving this award to an individual like me is ridiculous. This award does not belong to me, it belongs to all of us. And with that being said, I humbly accept this award for all of us. And I hope you guys give yourselves a big round of applause, because you deserve it.
Here to introduce the recipient of the Notable Community Impact Award is 2020 Physician of the Year, Dr. Christine Hahn.
Thank you. I'm still basking in those words and suddenly I saw my picture up oh, that's a mic. All right, I'm going to read some of this because I want to make sure I've got some quotes and I want to make sure I get them right. So this is the Notable Community Impact Award, which recognizes an Ada County Medical Society member physician for outstanding achievements in local community service and involvement. And this year's honoree is Dr. Alejandro Necochea, Medical Director at St. Luke's Health Partners and at the St. Luke's Community Health and Engagement Department. Dr. Necochea is deeply invested in a variety of public and community health matters in Idaho. He works directly with institutions that serve marginalized populations, including providing Spanish-speaking community members with information on timely health topics. Recently, some of you may know I work in public health. He has assisted our public health agencies on getting information about avian influenza out to Spanish-speaking Idahoans who are at particularly high risk. He has assisted me personally in testing Spanish-speaking workers exposed to TB and has worked to support immunization efforts by local health districts by providing testimony and support. He also plays a pivotal role in chairing the Idaho Medical Association's Public Health Subcommittee, which is how I first got to know him. We all admire him on the committee for his ability to corral the committee's wild ideas into coherent plans and to distill complex medical issues into clear topical briefs for physicians and legislators. Mike Cunnington, the IMA's lead for governmental affairs, summed the feelings up of the committee when he said, "We are in awe of his energy and passion." I have a couple quotes from some of his colleagues. Dr. John Schott, the Chief Medical Officer at St. Luke's Health Partners, says, "My first impression of Dr. Necochea 15 years ago or so was that he was incredibly humble and passionate about helping people. His CV and intelligence can be intimidating, but he comes across confidently with natural warmth. His focus, regardless in the hospital or if he's working in population health or in the community, is on making the world better." Dr. Jim Souza, who is here tonight, Senior Vice President, Chief Physician Executive at St. Luke's Health System, says, "Dr. Necochea is an outstanding hospitalist. He's the type of doctor who will and has paused during the admission of a vulnerable adult, realized there might be an alternative to an admission, and jumped into coordinating resources with family and community agencies to create a better situation for the patient." In addition, I've had the opportunity to work with Dr. Necochea in his legislative advocacy work. He fully understands the barriers posed in overcoming a bad bill, and yet he sees a potential pathway. He never quits trying to help. Lastly, Teresa McLeod, Director of Community Relations at St. Luke's Health System, said, "I have the pleasure of working with Dr. Necochea in his capacity as Medical Director for Community Health and Engagement. An example of his good work is the Fresh Fruit and Veggie pilot program for patients at St. Luke's Humphreys Diabetes Center. The program evaluation demonstrated initial promising results. With Dr. Necochea's dedicated advocacy and data brilliance, an initial expanded patient population has been identified. In addition to diabetes, patients living in a food desert vulnerable zip code will be offered the program this spring, and I am thrilled he's being honored." Finally, I'd like to wrap up this nomination with a personal anecdote. I've gotten to know Dr. Necochea on the Public Health Subcommittee, as I mentioned, where he's an enthusiastic and energetic president that drives much of what we do. But I really came to appreciate his dedication to public service one recent Halloween, where I was strolling down Harrison Boulevard with my adult daughter. We were there just to gawk at the costumes and the amazing decorations and enjoying ourselves. Looking down the road, I saw a lonely figure in a shark suit. But he had a clipboard, which is what really caught my eye. He was essentially the only person I could see that didn't appear to be there to have fun. Drawing nearer, I saw that it was Dr. Necochea gathering signatures for a ballot initiative. I was awed by his dedication and energy as he did his good work. And to me, that sums up Dr. Necochea.
Thank you so much. That was fun, actually. I really enjoyed gathering signatures and talking to doctors. Thank you very much. Thank you, Ada County Medical Society, for this recognition. Thank you to my colleagues in the Public Health Committee of the IMA. And thank you to my family, my daughter, Ava, my daughter Cecilia, and my wife, Lauren. They're studying actually because they have exams. Just a couple of brief comments. Sometimes it's frustrating to be out there. It's sometimes easy to be frustrated in Idaho by some of the things that happen out there in the real world that impact the health of our patients or our ability to practice medicine. Sometimes it feels like medicine and decisions that are being made out there are sort of dissociated. There are no decisions in the legislature, for example. But what gives me hope is that, contrary to common belief or what you might think, physicians, doctors are actually still one of the most trusted and respected professions out there, which is excellent. It's good news for you. Our opinions are held in high regard. Just like our advice can help patients make informed decisions about their health in the exam room, when we engage and give guidance to elected officials, to nonprofit groups, to public health districts, to boards of organizations out there, to chambers of commerce, churches, whatever, we can actually help start to solve some of the problems that impact our communities in general. So we can do this. It's very hard. But I just wanted to take a moment to thank all of you who are out there, elbowing your way into some of these conversations, stepping out of your comfort zones to write op-eds, letters to the editor, to make phone calls to elected officials, to testify in various forums, to give interviews, and to just help elevate the voice of physicians in the public discourse out there. It's very hard, as many of you have experienced, but it makes a huge difference. So thank you very much for all you do.
Here to introduce the recipient of the Vitality Champion Award is 2022 Physician of the Year, Dr. Jim Souza.
The Vitality Champion Award recognizes an ACMS member physician who provides significant leadership and energy to advance the well-being of physicians and APPs. The 2025 ACMS Physician of the Year honoree for this award is Dr. Deb Roman from Finding Health. It's my honor, my deep honor to introduce Dr. Roman. If you don't know her, she's a family physician, and she's been the most visible and energetic local doctor promoting physician and medical student well-being really for the past 10 years. She's launched multiple small group discussions for physicians and students, helped organize and host different large group gatherings and retreats, really kicked off St. Luke's focus on well-being many years ago through one of those forums. And she's been a huge contributor to the success of ACMS's Physician Vitality Program since its inception. And as you saw tonight, she's just ongoing energy and bringing new programs forward with coaching. During her term as ACMS president, couldn't have thought of a better person to lead through this time. She helped the organization navigate through a particularly polarized period of time involving some local medical politics, and she provided a calming, centered presence in leading meetings and discussions and listening to work through this. She's the co-founder and convener of the Idaho Physician Wellbeing Action Collaborative and a co-founder of the Compassionate Communities Healthcare Movement. On a more personal level, if you've never had the experience of a conversation with Deb Roman, then you have not experienced the intensity of her listening and the insightful curiosity of her questions. She sees opportunities in problems. She finds solutions in community with others. I get lots of appointments to my calendar, and I'm in so many meetings in my job. I tend to think of things in blocks of meeting time, and I can tell you that an appointment with Deb Roman might get rescheduled, but it never gets canceled, because you walk away from a conversation with her feeling like a better and more complete human. So Deb, the Ada County Medical Society would like to honor your enormous contributions to the richness and vitality of our medical community by naming you as the first recipient of the Dr. Deb Roman Vitality Champion Award.
Thank you guys so much. It is such an honor to be here, and thank you for those wonderful words, Jim. I feel the same exact way about you. If you would allow me, please, I really want to share this award with every physician in this room and all the physicians in our state. All those people, all of you who show up every day and care for patients and care for their families and care for our community. I think that you are the ones that stay an extra 5 or 10 minutes when a patient really needs your time. You sit with families that are navigating some really difficult things and help them to make sense of that. You're there for your colleagues. You reach out to them when they're struggling, and ask them maybe if we'd like to have a cup of coffee together, trying to get through some difficult times together. And you stay up late at night looking up things to try to help people and try to see if you can decrease some of their suffering. That's really the work that all of you do, and that is such vital work. One of the physicians who I find so inspiring is a man named Paul Farmer. He died recently, but he spent much of his life making sure that people in places like Haiti and other places around the world who didn't have treatments and didn't have resources could get them. And he talked about something called accompaniment. And what he meant by that was this way of walking with patients, of saying to them that my promise to you is that I may not be able to solve what you're dealing with. I may not be able to take away your pain, but I will walk with you for as long as it takes, and that alone will decrease suffering and increase healing. And that is what you do. You accompany people on this journey. Such beautiful work. I think about Vivek Murthy, who was the Surgeon General under Obama. And during COVID, he said that the world was locked in a struggle between fear and love. He said, choose love always. And he said, such is the rallying call for physicians and other clinicians who are out there every single day showing us what love looks like. That is what we do. That is what you do. You show people what love looks like. One of my teachers, when I first started training, said to me, you need to love your patients if you're going to do this work. And I think he was right. And it was such a beautiful lesson for me. So I really want to thank all of you for the beautiful work that you do, caring about people every day, caring about your patients, caring about their families, our community, and also about yourselves. Jim and I had a really nice coffee recently, and we were talking about what is it going to take to heal the world. We never quite go into like, how's the weather? Like, drop right into it, right? And we talked about this idea of caring, of truly caring about ourselves, each other, our community. I truly believe that that will heal the world. Honoring yourselves, truly important. Honoring yourselves, each other, and everyone out there. To me, that is the work. So I really want to thank you. I want to thank you for the work that you do. I want to please ask you to share this with me as the two previous honorees talked about. And I want to thank you for accompanying me on this journey. And I hope we'll have many more times together to have conversations. And please, please take care of yourselves. That's such an important part of all of this. So thank you so much.
next honoree was unable to attend tonight due to a prior commitment. Here to introduce the recipient of the Lifetime Achievement Award is Dr. Matthew Nelson.
The Lifetime Achievement Award recognizes an ACMS member physician whose life and career are a standout example of professional medical ideals. The 2025 honoree is Dr. Stephen Ryder, who recently retired from the St. Alphonsus Heart Institute. Words truly fail at recognizing this great physician. Over his remarkable career, Dr. Ryder has profoundly impacted the Boise community, providing compassionate, expert care to thousands. He was a founding member of interventional cardiology in the Treasure Valley and has helped to develop St. Alphonsus Heart Institute into what it is today. He has saved countless lives in the cath lab and has been a mentor to every doctor in the cardiology group. He is renowned for his approachable demeanor and dedication and has been a trusted figure for patients and colleagues alike. His enduring commitment to excellence and community well-being leaves a legacy that truly stands out as a model of professionalism and service. He has received the highest honor given by Trinity Health to those physicians with the highest patient satisfaction scores. The St. Alphonsus Boise Cath Lab has been named in his honor, an honor given to no other physician. Dr. Stephen Ryder, we'd like to present you with this Lifetime Achievement Award.
Well, I really appreciate the opportunity to be here and those kind words, and it's just amazing to realize it's been 41 years as cardiology here in Boise, and it's been only possible through my excellent support from the family and my wife who's accompanying me, and her dedication, loyalty, and my 3 children and now grandchildren. So it's been quite an adventure, and I don't know, starting off with some intervention back in 1984 was quite an ordeal because of the primitive nature of treatments, and just being able to participate in some of the advances, going through taking plaque out, atherectomy, rotational kind of rotoblader, laser, and then stents, of course. And it's really quite a journey to watch the technology develop over time. A couple hallmark things would be that, we had the beginning of the structural program in Boise with collaboration with a pediatric cardiologist, and we were able to start to close holes in the heart, which was not done previously. So that was a real hallmark type of development in the early 2000s. I would just say that there are 2 guiding principles that I've tried to live by. One, there's a gentleman by the name of Monty Roberts. Some people know him if they know anything about horse training, and he developed this concept of join up, which is so important in our endeavors to try to treat people, whether it's in the clinic or in the hospital, but especially if they're going through a interventional high-risk procedure. We really have to have their trust and faith and confidence, and join up means that they have a very solid bond with the provider. The other guiding principle is by a guy named of Leibniz, Gottfried Leibniz. He's a developer along with Isaac Newton for calculus, but he was a philosopher, mathematician, and he says if all men knew the same basic data or facts regarding an issue, we'd come to the same conclusion. And of course, in medicine, we all need to find those facts and deliver the best care based on those. Anyway, I just really appreciate the opportunity to be here and to be in this community, to share this award with my family, who is so important. I can only mention Mim Randall, who's been a colleague of mine for over 20 years as a nurse practitioner. My very first inspiration about cardiology was with Dr. Charles Erickson, who's a physician now retired, a wonderful guy who inspired me based on some research we did together and just the principles of cardiology that became so fascinating and interesting, and many others. I'm very delighted and just honored to be part of this group. Dr. Nelson is a great doctor and a great leader, and so many young people around the campus of St. Al's, around me, that I feel very confident in the future of our hospital and the community. So thank you.
Here to introduce the ACMS Friend of Medicine Award is Awards Committee member Dr. April Dillian.
Okay, this year an entirely new award category was created that was not for Physician of the Year per se. The ACMS Friend of Medicine Award recognizes an individual, organization, or entity who has contributed significantly as an advocate and champion of the local medical community and healthcare ecosystem. Our 2025 honoree is Boise State Public Radio's Idaho Matters. Since its inception in 2018, Boise State Public Radio's weekday program, Idaho Matters, has been a trusted source of information and engaging discussions on issues that affect Idaho and Idahoans. In 2020, people really turned to Idaho Matters and wrote in with questions, asking and searching for information regarding the COVID and the coronavirus pandemic. This is when the show introduced the weekly Wednesday Doctors Roundtable and provided timely, fact-based, evidence-based updates by local experts. In addition, the show has really added in and transitioned and brought to the public's ear a wide array of health topics, including other emerging infectious diseases, seasonal health issues, climate change health impacts, preventative health measures, and developments in medical education and healthcare policy. We as physicians and healthcare providers really have one-on-one influence with our patients. And I've been really thankful and grateful for the larger audience that Idaho Matters has. Idaho Matters has been able to explain to all their listeners how the community public health affects us as an individual. It is helpful to be able to hear our local experts, the way they engage with people and their interview style. The community can really hear and listen to great information, be able to take that in, and more people can be reached this way. And I really think it's really important. The more we inform our public and our community, really the healthier our community can be. While the doctor's table had a number of physicians added, I would really like to mention Dr. Pate specifically and his dedication to the program over the last 5 years. And here to receive the award for Friend of Medicine for the show is the host, Gemma Gaudette, producer Samantha Wright, and co-producer Hannah Gardeski.
I'm Gemma Gaudette, the host of Idaho Matters, and this is Samantha, my senior producer. I'm a journalist. I was not smart enough to ever be a doctor, and I feel very unworthy to be here tonight. So thank you for all of you do. And going back 5 years ago, as was mentioned, we were getting inundated with questions about what was going on when the COVID pandemic hit. And one day, Sam and I were just sitting there talking about, what could we do? I mean, we cannot have people, we don't know how to answer all of these questions. And we thought, well, do you think we could actually ask doctors to come on the show in the middle of a pandemic? I mean, I think going to do this. And we thought, well, the worst they can say is no, so let's ask. And it was a resounding yes by St. Luke's and St. Al's. And for upwards of a year, we had 3 doctors, Dr. Pate, and then a doctor every week from St. Al's or St. Luke's. Sometimes Dr. Hahn came on the show as well. And it was all of you who made the difference. I get a little emotional sometimes about it. Anyway, so thank you for what all of you do. And we also, Dr. Pate is not here today with us. Well, because I'm gonna start crying.
Okay. So let's back it up to the COVID pandemic when every doctor, every medical professional, every nurse was working hours and hours and hours of overtime and putting everything into saving lives. And we said, would you really be willing to come and share a little bit of time when you don't have time? When you don't have time to be with wives or with kids already, would you be willing to come on the radio for 10 minutes, 20 minutes? And everybody said yes.
Yeah.
Everybody said yes. It wasn't just St. Luke's, it wasn't just St. Al's, it was anybody we contacted, they said, yes, we want to be on the show, we want to answer the questions, even if the answers were, we don't know yet. And that was so important for our listeners because not only were the cutting edge answers there, but the answers of, we don't know, here's what we're trying to do to find out. And that kind of reassurance for the people who listen to our show was invaluable during that time. And then after the pandemic, not that it's over, but after the height of the pandemic, it continued. Let's see, Gemma asked people to come on the show and talk about things that weren't as comfortable, maybe like menopause or prostates or colon cancer, and getting a colonoscopy. Nobody wants to talk about that for 12 minutes. But we did it, and you did it, and we are able every week to help folks out, not just with the Doctor Roundtable, but with other segments, because you can't have a Friend of Medicine award unless the medical community befriends you, and that's what you've done.
And it really is because of all of you. And so we thank all of you very, very much. And when I look out at this room, it's incredible how many of you that I have met and how many of you I admire. Dr. Bob Lindsay was our pediatrician until he passed away. Dr. Kaplinger delivered my very first baby almost 17 years ago to the day. Pat, he was 17 on Saturday, he is 6'2". That little 6-pound baby, all the hair, and I am so thankful for all of you and everything that you do. And as we mentioned, we could not be doing what we do every single week on Wednesdays without Dr. Pate. I know a lot of you know him. He retired right before the pandemic hit. And he was kind enough to come on the show every Wednesday. He still does that. He does not get compensated. He comes on out of the goodness of his heart to make sure that we do give fact-based information every week. He answers questions. He still has his blog. He is so incredibly involved because he wants to make sure that our community stays informed. He had planned on being here today with us because I think that this award really doesn't mean anything without what Dr. Pate has done. And as some of you know, some of you may not know, his wife suddenly passed away last Monday, May 5th. And Dr. Pate is taking a little bit of time away from the program. He will hopefully be back in the next couple of weeks, but we could not do what we do without him. And Dr. Epperly has been kind enough, he has stepped in the last 2 shows. And so we're so very thankful for all of you, for everything that you do. But if we could raise a toast to Dr. Pate's wife, Lynette, tonight, I know it would mean so very much to him. Thank you all so much.